You're watching your local news leader. This is WCIA 3 News at 6.
We had really hoped last year at this time, after the vaccines were introduced, that we will be over it. Then, things changed again.
The COVID pandemic has lasted a lot longer than health experts predicted early on, and these days there's seemingly no end in sight. Good evening, I'm Jessica Coons.
And I'm Jennifer Roscoe. Back in 2020, the goal was to develop a vaccine and get to herd immunity as soon as possible, meaning reaching a point where enough people are protected against the virus that continued spread is unlikely. We have team coverage tonight on this. Renee Cooper is live in the WCIA 3 newsroom. Cole Henke live in Springfield. First to Renee. So, two questions. Renee, are we anywhere close to reaching herd immunity? And what point do we need to hit to end the pandemic?
Well, Jennifer, the magic number for herd immunity was fully vaccinating between 70 and 90% of the population back in 2020. And in some places, we're there or almost. The CDC reports more than 69% of people in Illinois 5 and older are fully vaccinated. And if you look at just adults, that number jumps up above that minimum herd immunity threshold to 74%. But as a top epidemiological expert tells me, that's not enough. So we dove into the newest expectations for when and how we reach the end of the pandemic that's been defining this decade so far.
Herd immunity should be achieved pretty quickly and for the entire population.
Instead, it's taken the state of Illinois about a year to achieve the bare minimum 70% vaccination rate. And that doesn't include kids under 5.
We are not really, in essence, achieving true herd immunity.
Not to mention, the higher vaccination rates are concentrated in certain areas. Vermilion County notably hovers around 40%, about half of the original herd immunity goal.
We do interact with a lot of people, both local, statewide, national, and even international. So that concept does not really apply as well as we have seen with other infectious diseases like measles or mumps, where 90% or so in the entire population would be effective in controlling the infection.
Owais Vade is an epidemiologist at Champaign-Urbana Public Health. He's been front and center in the battle against the ever-evolving coronavirus since day one.
It has been a little difficult to pinpoint, if we get to 90%, will that mean the pandemic is over? I don't think that's as simple as we had thought initially.
Vade is hopeful that a combination of continued vaccination efforts and natural immunity from the Omicron variant will soon lead us out of the pandemic and into an endemic phase. That means the virus is still around, but there would no longer be reporting of daily infections and no asymptomatic testing.
We also don't tell people to mask and distance anymore because that's really had to do with trying to keep it at bay. But when you go into endemic phase, you treat it like influenza.
With seasonal precautions.
And so we used to, try to hunker down, try to avoid close proximity, try to avoid indoor gatherings during those times.
When we'll reach that point is not totally clear.
We can estimate many things. We have been wrong a lot in the past. If it was up to me to estimate something, I would say that in the next few months, things will look as close to the new normal as we would expect.
Now, Vade says he's been hearing that more and more people are purposefully getting infected with the virus rather than getting vaccinated. He strongly cautions against that. Although it has resulted in more mild cases than past versions of COVID-19, there still have been plenty of severe complications, and that risk is just not worth it. His take-home message, get vaccinated and get boosted, because that's what keeps keeping people out of our hospitals. Live in the newsroom, I'm Renee Cooper, WCIA 3, your local news leader.
Renee, thank you so much. Now, Governor Pritzker held a news conference today to talk about some promising signs